Good morning, everyone. My name is Wasaphon Suphakitchanusan from Wasaphon Hospital, and today I will be presenting an update on lateral meniscus root tear. We will cover the definition, prevalence, important diagnosis, and treatment options for this injury, focusing particularly on the posterior root tear, which are much more prevalent. So the lateral meniscus posterior root tear are significant injury that often occur in conjunction with ACL tear. This tear involves an avulsion injury of a radial tear within 1 centimeter of the meniscal attachment. They are found in 7 to 15% of the patients undergoing ACL reconstruction. This means that 1 in 8 patients undergoing ACL may have a lateral root tear. In contrast, they are much less common in isolation, occurring in only 0.8% of patients with an intact ACL. Why are they important? This tear disrupts the normal biomechanics of the knee, which can exacerbate instability, leading to increased contact pressure and the potential for early osteoarthritis. In terms of knee stability, biomechanics studies have demonstrated that this tear increases anterior tibial subluxation and translation, particularly during pivot shift maneuver in patients with ACL tears. As you can see in this chart from biomechanics study from Frank in 2020, show that ACL with lateral root tear, blue and black bar, increased tibial translation from ACL tear alone, the red bar. On the other hand, in patients with ACL injury and high-grade anterolateral instability, lateral meniscus posterior root tear is one of the associated structure injuries that should be considered. Furthermore, repairing lateral meniscus posterior root tear at the time of ACL injury has shown to be beneficial. For instance, study by Tang in 2019 found that lateral meniscus posterior root tear repair decreased tibial acceleration during the pivot shift test. Similarly, this finding from Katakura show that repair improved anterolateral laxity and reduced ACL graft force in ACL reconstructed knees. Regarding to load distribution, complete radial tear of the posterior root of the lateral meniscus significantly increased lateral compartment contact pressure and decreased contact area. Also, repairing this tear can significantly improve lateral compartment joint contact pressure, which is crucial for maintaining knee health and may prevent OA progression. This picture from study by Lateral shows pressure mapping of the lateral compartment. Blue color indicates the good pressure distribution, while green indicates the increased pressure, which is bad. On the left side, we can see that the pressure distribution after root tear showing an increased pressure. And on the right side, after repair, the pressure distribution is improved. In the term of biomechanics of the lateral meniscus posterior root, another structure to consider is meniscofemoral ligaments, which are present only on the lateral side, and it plays a crucial role in the lateral meniscus stability. Study by Schillhammer showed that isolated complete tear of the lateral meniscus posterior root and progressive radial tear of the lateral meniscus posterior root are not associated with the change of tibial-femoral contact pressure force compared with the intact knee. However, additional resection of the meniscofemoral ligament can increase the contact pressure and decrease the lateral compartment surface area, underscoring its importance. As we see in Lapas classification, which is popular in the meniscal injury, he included the meniscofemoral ligament variant root tear in the type 2 of lateral root. He also observed that when the meniscofemoral ligament is present, it confers the stability to posterior lateral root tears, prevent increased mobility and meniscal extrusion. Diagnosis of lateral meniscus posterior root tear can be challenging. Preoperative MRI is a standard tool, but this tear can be difficult to detect due to the anterior oblique cause of the lateral meniscus posterior root attachment. Studies show that 2/3 of the lateral meniscus posterior root are missed on the preoperative MRI, and sensitivity for detecting this tear is lower compared to the posterior medial root tears. Because of his high rate of underdiagnosis in preoperative MRI, surgeons performing ACL reconstruction should maintain a high degree of suspicion of the lateral meniscus posterior root tear and be well prepared to repair them, especially in cases with high degree of instability. During the surgery, it's crucial to carefully assess the integrity of posterolateral meniscus root and meniscofemoral ligament. The posterolateral meniscus root can be displaced superiorly and anteriorly, and a positive lift-off test can indicate a tear. Regarding to treatment options, For stable lateral meniscus posterior root tear detecting during ACL reconstruction, leaving them in situ can be an option. Chambersky reported that this patient with stable lateral meniscus posterior root tear left in situ after 15 years has similar primary outcomes such as IKDC score comparing to the patient with intact meniscus. The study also found that no significant difference in ACL graft rupture rate between the lateral meniscus posterior root tear group and intact group. They suggest that leaving stable lateral meniscus posterior root tear in situ does not negative impact outcome. However, we can see the Y of the confidential interval in the living in situ group, which means that some of these patients may not have a good outcomes. Also, the conclusion of the graft rupture may be underpowered. This suggests that restoration of the biomechanics of the root attachment should still be considered. Restoration of the normal knee joint contact pressure and biomechanics can be achieved with lateral meniscus posterior root tear repair and improve patient outcome in ACL reconstruction. A systematic review by Perry in 2023 has shown that lateral meniscus posterior root tear repair with concurrent ACL reconstruction result in improved reach home and IKDC score, supporting the benefit of the surgical repair. There are several repair techniques for lateral meniscus posterior root, including side-to-side sutures, transtibial pull-out suture, and anchor sutures. Each technique has its indication and benefits. Side-to-side sutures are used for the radial tears with adequate tissue quality. This technique involves in suturing the tear using suture hook or inside suture. It's an effective method for reducing meniscal extrusion and restoring hook stress. Transtibial pull-out sutures are recommended for root avulsion or poor tissue qualities. Sutures are pressed to the meniscal root and pulled through the transtibial canal, providing strong fixation and restoring biomechanics of the lateral meniscus. As you can see with this video, we begin with an examination to locate the root attachment. And then we suture the meniscus using high-strength sutures. After that, we prepare the footprint by removing some of the cartilage to expose the bone for the footprint attachment. After that, we drilling the tibial tunnel. With this step, we should taking care of to ensure that the guide does not go too posterior. And then we pass the leading sutures. And pull the suture out and attach with the anterior tibial cortex. But when we use this technique, we should be concerned about the tunnel overlapping. Because lateral meniscus posterior root tear usually occur with ACL tears, we will almost always face the two tunnels in the cross area if we perform the tibial pull-out for lateral meniscus posterior root tear repair. Tunnel overlapping could compromise the fixation, either ACL reconstruction or lateral meniscus posterior root tear repair. Last year, the Florida reported a study with 27 saw bones and found that the tunnel overlapping occurred in 25% of the cases with ACL and lateral meniscus posterior root tear repair. Parallel drilling parameter between ACL reconstruction and lateral meniscus posterior root tear repair did not necessarily limit the overlap. In this study, they suggest that a lower ACL drilling angle, like a 55 or 60 degree, combined with a greater lateral meniscus drilling angle, like a 65 degree, should be used because it produces no socket tunnel overlap. Another technique for repair is to use the suture anchors. This technique provides adequate fixation strength, may reduce the bungee effect, and will not face the tunnel overlapping problem as we mentioned previously. There are several repair constructs. We can use a single row anchor with a double or triple loaded sutures. Or we can perform a double row fixation to create a greater area of contact on the repairing surface, but increase complexity of the operation. Various methods to deliver the anchor include using an axillary posterior portals, or without establishing the posterior portal but use special technique by a soft anchor with a curved due sleeve, or outside-in drilling, then pulling out the soft ankle with the sutures. This technique helps ensuring accurate and suture ankle placement. However, the best or optimal technique for the repairing lateral meniscus pulley root tear is still under debate. About the anterior root tear, they are less common and there are few studies about them. In 2022, Espenjo-Lena conducted a cadaveric study and found that anterior root detachment significantly reduced the contact area and increased pressure on the tibiofemoral cartilage. These alterations are more pronounced in the lower flexion angles of the knee, similar to the total meniscectomy. Surgical reinsertion is partially restore the contact biomechanics, but does not fully recover to pre-injury status. Therefore, careful attention should be paid on the proper diagnosis and treatment of the detached of anterior root, and the observed of anterior knee contact may induce the similar degenerative problem to the cartilage as with the completely detached of posterior root. So, in conclusion, the lateral meniscus root tear must be accurately identified as they can significantly alter the knee biomechanics, contribute to the failure of the ACL reconstruction and the development of osteoarthritis. MRI may not always detect this tear, so throughout the preparation and diagnosis vigilance are essential. Whenever feasible, surgical repair should be pursued to restore the knee function and prevent long-term damage to the cartilage. Thank you for your attention.
So we are going on